Welcome to the Health Leader Forge, a joint production between the University of New Hampshire and the Northern New England Association of Healthcare Executives. My name is Mark Bonica, and I am an assistant professor in the University of New Hampshire's Department of Health Management and Policy. Today's guest is Richard Corder, a healthcare consultant and managing director at the management consulting firm TiER1 Performance Solutions. In this podcast, we discuss Richard's journey from his start as an apprentice in the hotel industry in London, England, to following his heart to Boston, Massachusetts, his decision to enter the healthcare industry after his own experience as an inpatient, and how he applied lessons he learned from the hospitality industry to become an expert on patient experience, and ultimately his move into healthcare consulting. We conclude the podcast with a discussion about leadership and mentorship. I hope you enjoy listening to Richard's story, and if you find it valuable, won't you leave us feedback on iTunes, Stitcher, Spotify, or wherever you may be accessing this recording. It helps other people discover us. Thanks for listening, and here is Richard Corder. So welcome to the podcast, Richard.
Thank you for having me. Good to be here.
So you studied hospitality management at West London University in London, England. What brought you to West London University and what interested you in hospitality?
So I have been in hospitality, summers, vacations, weekends since I was a kid. So probably before the legal age of being technically allowed to work, I was bar backing and waiting tables because I suppose I liked the color of money at that age, and it was something that I realized that if the better you did it, the better the tips were. So the better you performed, the more I earned, and I enjoyed, quite frankly, serving others. So a career in the hotel business was always something. Certainly, as I got through to the end of high school, something that interested and something I applied to go to college to do. I unfortunately didn't technically graduate from high school. So I don't have a high school diploma. I didn't have a high school diploma. And so I went to work in London at the Savoy Group of Hotels as an apprentice. And it was through that, then in the weekends and evenings, that we went to school to get a technical degree. And so the University of West London, I think it was called Slough University at the time, but it's changed its name, was where we went, where my cohort and I went on the weekends and the evenings. So it wasn't as if I chose West London University. It was where you went if you were an apprentice at the Savoy.
Interesting. So I've heard a lot about apprenticeship programs in Europe. It seems like it's more of a European thing. Is that the kind of program you were involved in, where it's a structured kind of program, or is it something else?
No, very structured, 5 years.
Wow.
Every aspect of, you can imagine every aspect of hotel operations. So, and really structured to be from a very, very junior roles when you start to ultimately what would be close to, I suppose, a capstone project in your fifth year capstone role in your fifth year. And I spent most of my fifth year in the sales marketing side of the Savoy Hotel. So, and we used to joke, you pass through the apprenticeship. It's designed like this, but it felt as if you would be promoted once you became competent. So once you mastered your particular role you were in as a butcher or a baker or a chef or a waiter, and it was literally those basic of positions. Just when you thought you'd mastered it, then you get moved on to the next one. Which in retrospect, I think you look back and go, wow, it's a really rich, incredible learning experience. At the time, it was probably quite frustrating, right, Frank? It's good. I loved it.
Just as you were getting competent, you get yanked to something else.
Yes, right.
Yeah, all right. It's sort of like the Peter principle, but intentionally.
That's exactly it. That's exactly right, Mark.
Okay. So you finished that program, and looking at your resume, it looks like you came pretty much right away, came over to Boston to work at the Four Seasons. Is that accurate?
So it's accurate for the resume, because what the resume doesn't reflect is the real story, right? So actually, at the end of the fourth year, and those were academic years of the apprenticeship, at the end of the fourth year, I won a menu competition through the hotel group, which afforded me a scholarship to either attend Cornell or Lausanne in Switzerland. So I chose the Cornell Hotel School. So I came to Cornell for a 7-week executive development program in the summer of 1992. And who would have known that also going to the same executive development program is the woman that's now my wife of almost 25 years. So,
Oh, wow.
that's what
Okay.
the resume doesn't believe is I met and fell in love with my best friend that summer. And she was working, running a conference center in Boston for John Hancock.
Okay.
So I went back to finish my final year of the apprenticeship and figured while I was doing that, just networked and found that there was a common friend between the general manager of the Four Seasons in Boston and me. So networked and got an interview. And so that's what then allowed me to move to the States in the summer of 93, was then to take that job at the Four Seasons Hotel in Boston, which also happened to be 2 blocks from my girlfriend's apartment.
Oh, that's convenient. All right. So you came to Boston for love. That's not. So what was it like, leaving London, leaving England and coming to Boston?
I think so wonderful, because long distance dating, a long distance relationship is just, it's heartbreaking and it's bloody expensive.
Yeah.
So all that fell away. So and from a work standpoint, it was especially interesting because what I had learned in London was, very, very high standards, but in around service and around operations, but in a very formal environment. And what I was then afforded at the Four Seasons in Boston was similarly very high standards with a high level of expectation for those for whom you're serving, but in a little bit more of a, dare I say, an informal environment where we would bend the rules a little bit more. And so it was dare I say, a more fun kind of space
Okay.
to still deliver a high level of quality and service.
How much of that was corporate culture versus, regional culture?
It's a good question, Mark. I suppose my immediate reaction is, say, corporate culture. I mean, I was learning in those days, our culture at the Four Seasons Hotel in Boston was part corporate culture out of Canada, where, Four Seasons had been founded. But it was in a large part what made it so unique and special in Boston was our local general manager, was Robin Brown. And the way he led, his expectations of us, the environment he created, what he rewarded, I probably carry with me to this day as far as how I lead. So it was probably, I want to say it was as much local culture instilled and led, Mark, by Robin Brown.
Okay. So, so you spent about 4 years with Four Seasons, and then prior to that, you had been in your apprenticeship for 5 years. So a long time. I mean, and even before that, you were saying part-time work as a kid. So what were the most important lessons that you learned from your time in hospitality? Because we're going to talk about you're making your jump here into healthcare in just a second.
Hire the right people. And I know that probably sounds really basic, but hire the right people, train them well, give them the resources and the tools, and put them in the system to do their best job, and then get clear about what you expect and get out of their way. Most folks that I experienced in my hotel days, didn't just wander into a hotel and say, "Oh, I think I'll work in a hotel for," there's nothing better to do. They were called to do it because they love an aspect of the business. It's different for different people. What raised us up in Boston, and I think at the time, so early mid 90s, made us the number one brand in Boston, is we really took care of each other. and we believed that if folks were working in a system that allowed them to do their best work and supported them to do their best work and made doing your best work easy, if the system was not kind of the inverse of that would be the system was not stacked against us. It was easy to go in and do your best work. It was easy to make a decision, feel empowered, take a risk. So that would be my headline, Mark. Is what I took away from it was people, and then put them in the environment and give them the tool, put them in the environment to do their best selves, and give them the tools and resources to do that.
I mean, that's kind of that sounds like you've carried that forward. We're going to get to that a little later here, but okay. So you, like I said, you spent about 4 years with the Four Seasons, and then you joined the Northeast Health Systems as an environmental services supervisor. So here you're leaving hospitality per se, though I suspect you maybe that's. I know that there is a significant element of hospitality, right, in our business, in our healthcare business, right?
Yeah.
So you took on this role of environmental services. How did your training and experience in hotels allow you to jump over to hospital management?
So, environmental services is a fancy way of saying housekeeping, right? So it's
okay.
And while there are levels of high-level disinfection and certain precautions we take in healthcare that are clearly different than hospitals, it was a transferable skill. And if you go back to not technically having a high school diploma and not having worked in healthcare before, I had to find something that allowed me to kind of transition relatively easily, I should say. So, and the first job I got at what is Northeast Health Systems Beverly Hospital, now part of Leahy, was on the evening shift. So I guess I put him on the 3 to 11, and he can't do much damage.
Okay.
And that was an intentional move, partly as a result of having been a patient. So
okay.
I was admitted to a hospital while I was still an employee of the Four Seasons, and got to be a patient at a hospital for 5 days, and found myself reflecting on some things that I was seeing that didn't seem to be that well designed, that well managed, that well resourced. Back to what you were just asking about, kind of what were the lessons from hospitality. Those elements didn't seem to be in play. And so that pivot was quite an intentional one, driven by this belief that I don't mean to put a negative spin on it, but the thought at the time that has stuck with me is if we ran a hotel the way they were running a hospital, would be out of business. It just didn't seem that well designed or that well resourced or that well. But far be it from me to stand on the outside and posit towards something I didn't know. And so I made the decision to shift, to make a career shift. And yeah, like you say, go from being on a management track at the Four Seasons to getting the evening shift housekeeping supervisor role at the local hospital.
So this was not like a kind of a random, I could make a couple of extra dollars maybe kind of thing. It was you knew you wanted to go into healthcare. That's neat. And
then, in fact, completely contrary to wanting to make a couple of extra dollars, it was antithetical to that, Mark. It was I actually took the second shift because there was a $2, I think it was $2 an hour extra differential for working, and still that was far below what I'd been making at the Four Seasons. And I just remember my wife looking at me and saying, I hope you know what you're doing.
Okay.
Not fortunately, we had, I think our first child was a baby at the time, so we didn't have a lot to put at risk. But it was certainly a downshift, I suppose.
So, looking at your some notes you had about your time there, you talk about improvements in service measures. And so what were you trying to do? What was your vision going into this role? If you had made this deliberate shift, you took a cut in pay in order to do it, what were you, what did you learn in that first job in healthcare, and how did you try to bring what you had learned in from your time with the Four Seasons and your other experiences in hospitality?
So I went into it with I suppose, at the time felt a little Pollyanna, but a belief that that would be a good way to learn healthcare. It would be kind of a practicum. It would harken back almost to my days of an apprenticeship. An apprenticeship wasn't available, but for anyone who's worked that kind of shift work, about as close to the front line of operations, there's no quicker way to learn a business. And so, especially in hospitals, when you're not on the day shift, your staffing level drops, and yet the acuity of your patients does not. It just requires it's an all hands type of mentality, and you get to see how a business works, and you get to see what works and what doesn't. And I used to joke, with a uniform and a set of master keys, you can also get pretty much anywhere in the hospital. So you just wander into places and introduce yourself, and it was really through that I got then recognized by a vice president who was the one that suggested I go to school and get my master's degree. So, but it was very much the thought was this is the way I could learn. What did I bring over? Some just basic stuff about how we communicate. So, as an example, before every shift, instead of staff just coming in, signing in, going to their assignment, the shift staff, I would always get there early, always make sure that my expectations of them were things that I was taking seriously. So clean, pressed uniform. If I wasn't wearing one, how could I expect other people to wear them? And I think that was different for a lot of folks that I was walking into an environment that was, typically a little bit in the shadows of the hospital in the evening. Getting there early and doing what we in the hotel business would call a pre-meal. And just doing a stand-up kind of huddle of, okay, these are the assignments. Busy hospital tonight. We've got a busy emergency room. And I think for the first couple of cycles through that, people looked at me going, what are you doing? And it was just this sense of, let's all get on the same page. Let's understand what we're here to do. And I forget, I think it's a US president who said, whatever you are, be a good one. Let's make this place as clean and as safe as we can make it. That's our job, and that's an important part of extraordinary patient care. And just that daily reminder to folks of, you got a really important job, and let's go do it, and let's do it together, and let's think as a team. A lot of it was that from memory, Mark, and I loved it because I don't think these people have been cared for like that before. It's pretty special.
That makes a big. My experience as a manager, and just having people believe they're cared about is a really important, right? Pretty basic, but it's easy to overlook when you get busy and
just cared about as human beings. And someone shows up late, and I think that their previous experience of being the first reaction was they were going to get written up. It's like, well, no, why are you late? What's going on? Well, it's difficult to get to work. Why was it difficult to get to work? Well, I don't have a car. Okay. Anybody else here got a car, lives near Joe? Could you pick him up? Yeah, I'll do it. It's like, that's community, that's team, that's people taking care of each other. And you don't get that if your default is anything other than relationships and people. So that was just fun.
So you were also working on your master's at the time.
Yeah.
Yeah. How did that help you make the transition? So you're working on a master's in health administration, right? MHA?
Yeah.
So how did that help you continue to make your transition from hospitality into the health industry?
I guess what was interesting for me was school up until then had always been a real struggle because I could never apply. And it's one of the reasons that I had such a hard time in high school. Now that reflecting back, is I couldn't apply it to what practically made sense to me. And I didn't know that at the time, but I remember being in high school with a course load of mathematics and physics and what have you. And remember looking at the coursework and going, how is this going to help me run a hotel? And so I could never do it just felt out of context. So when I found the curriculum of the MHA, all of it spoke to me. I could see it. the accounting was in the context of healthcare. There were all these practical applications. So I could just see it. And then in class, I would have examples of, trying to get a budget to work, trying to get the right amount of FTEs for certain amounts, for a certain kind of, in our world in housekeeping, it's typically around cleanable square footage. So it all became just really practical, really quickly. And so I hit my groove. It became easy. And then it was easy to go to, and I think one of the things Simmons afforded us was they actually expected us to come to that particular, I don't know, was that particular cohort, or whether it was that particular class, or maybe the professors, but they expected us to bring different perspectives to the healthcare coursework, if you like, Mark. So it was encouraged to say, well, what would a lesson be from hospitality that we might think about this particular problem differently? So it all started to just make sense. I remember finding myself looking forward to going to class, which had never been a part of my reality.
That's great. So you spent about 3 years with Northeast Health Systems, and then you made the jump, as we were joking before we started, to west of Worcester, as they say in Massachusetts. So this is referring. You went out to kind of the western side of the state to work as director of guest services for Cooley Dickinson Hospital in Northampton. And I was I joke about the west of Worcester thing because my sister was actually born at Cooley Dickinson, and I'm a UMass grad a couple times, and all my family is, so we were all like connected to that area. So affectionately refer to it as west of Worcester, and the Happy Valley, as
yeah.
But what took you out to Cooley Dickinson? You can't shake a stick without knocking into 25 different hospitals in Boston. So what took you out to the western part of the state?
So right place, right time, or wrong place, wrong? No, it was absolutely right place, right time. One of the really favorite parts of my career. I love that hospital. I love Northampton. We lived in Amherst. And it was right place, right time, right kind of sequence of events. So what was happening in the late 90s, Mark, I don't know if you recall, but hospitals were going through an awakening almost to this recognition that a patient may actually have a valid perception of their care that hospitals should be, I'm really kind of simplifying it, but should be paying attention to. And so what was beginning to get crafted and ultimately put into place were what we now know as HCAPs, or the early days of value-based purchasing. And one element of value-based purchasing was going to be a patient's perception of their care. So they were going to be surveyed by a hospital to say, please rate your care. So what hospitals were, I think, beginning to kind of wake up to is this service customer element to what they needed to pay attention to in their market. And specifically hospitals in competitive markets, and as well as, right, because Cooley Dickinson's in a pretty competitive market with Baystate to the south and UMass to the east. If you're looking for a large academic medical center, you've got options, not that far away from Cooley Dickinson. And the CEO at the time, Craig Mellon, had specifically gone out to search for what, at the time I think was called Director of, I can't remember the title now, I think you just said it, whatever it was called.
Guest Services. Right?
Guest Services, thank you.
Yeah.
And it was funny because the search firm had reached out to me while I was still at Beverly Hospital. I was still at Northeast Health Systems. And I'd gone home to my wife, who was born and raised actually in the town we live in Ipswich. And I said, hey, what about looking at an opportunity out in Northampton? And she said, and you'll appreciate this, Mark, she said, home of Zoo Mass? There's no way we're moving out. So I was like, what do I know? Okay, I'm still relatively new to the state, new to the country. I said, no, I'm not interested, but thank you very much. And then about I don't know what it was, Mark, but maybe it was 2 months later. I was actually in class at Simmons, and one of my classmates was a senior manager out at Cooley Dickinson.
Oh,
And
wow.
she said, Richard, this is going to be sound really weird, but we're looking for what I think is you. We're looking for someone with a hotel background, but that's got now enough experience in healthcare that you could actually manage and oversee all of our non-clinical support departments. So I went back to my wife. I said, well, this is twice now that this has come to us. So we should at least go take a look. And we went out to Western Mass and went out for a weekend, actually, before I actually even interviewed. And just spent a weekend out there. And it just, as you know, I just fell in love with the area and walked through the hospital. And it just all, it sang to me. And so we interviewed, and I was very fortunate to get the job. And we moved out there. So
Yeah, it's a beautiful area. I mean, we're joking about it, but it's a beautiful area.
It's just stunning, and the people are special, and everything about it was just super opportunity. The job was great. The opportunities I was afforded by Craig and the senior team and the board were incredibly. I would have to pinch myself some days and go, okay, I'm still not 40 years old, and I'm being given all of this serious responsibility. And it was just fun. It was just a blast.
So you went out as director of guest services. You were there for 8 years. So I'm just going to kind of summarize here for a second. You were there for 8 years. And when you left, you were the vice president of operations and facilities management. So you made quite a progression as kind of what you were given quite a lot of trust. So how did you go about that process? Like, how did you find yourself? How did you, move up? So you had been director or night supervisor of housekeeping. How do you go from there to vice president of operations and facilities management?
It's probably dumb luck. You ask for things. I mean, the old reminders of ask. If you want something, ask. And what's the worst thing that can happen? Someone's going to say no. And I think the older we get, we sometimes just forget that, or we shy away from it, or we don't have the courage to. Well, what's the worst thing that's going to happen? I mean, you're not going to lose. You're not going to. I mean, someone's going to say no. And then the flip side of that was, I'd also say yes to everything before I knew what I was saying yes to. So I remember sitting in a senior management team, and Craig said something like, and I'm sure if you talk to him, he'd remember the story very differently. But I remember the story as who wants to oversee us getting prepared for the next visit from the Joint Commission? And I said, oh, I'll do that. And we walked out of the meeting, and one of my colleagues looked at me. She goes, you have no idea what you just said yes to, do you? I said, nope, not at all.
Oh, no.
But I got to figure out. We got to figure this out. She goes, and she had some kind of, fresh remark like, don't come crying to me when, you realize you're working 15 hours a day. And so it was that. It was kind of, if I wanted something, I asked. And it wasn't always pretty and easy. And there was a couple of times when I think, Craig and I probably went, toe to toe, not nose to nose. That's too extreme. But where we had to say, okay, you stick to what you're doing, I'll stick to what I'm doing. But yeah, ask, say yes before you know what you're going to do. And then just surrounded myself with just a superb team. I mean, the team that we built out there, and it wasn't without some turnover at times, but just some of the best I've been fortunate to work with. And we knew what the job was, and we got on and did it to the best of our abilities.
So they were looking pretty hard for somebody pretty specific when they came and recruited you.
Yeah.
What was the problem they were looking to solve?
So I think the problem they were looking to solve, good question. When I got there, we had some pretty deplorable measures of the experience that our patients were having. So we were using a vendor at the time, and I want to say for hospitals our size, I think we were in the single digits of performance compared to other hospitals our size. And Cooley Dickinson had by then a track record of lifting itself up from poor performance. Craig had done a stellar job. I think he'd been the modern healthcare's top small turnaround hospital several years before. So he knew that you can go from zero to hero with the right people and the right resources. And so I think they wanted to move that, and I think they wanted more of a kind of cohesive service orientation to what I would call our support services, our non-clinical support services, so housekeeping, food service, facilities, the kind of infrastructure that we put around the folks that are there really doing the running of a hospital. And I'm being a little crass with it, but it's the doctors and nurses show up every day that we're going to care for patients. For all of that, you need to put an infrastructure around it that makes it hum, and we were that. And so it was. So I think it was part organize all those things under one umbrella, and then it was also what are we going to do about the measures that are important to us, and are going to start becoming even more and more important because they're actually going to start putting some dollars at risk if we don't improve.
Yeah. So tell me like one thing you did that really made a big difference. Was there one, can you point at something?
We really changed up how we did our new hire orientation. So we really wanted to showcase the culture that we were creating, that we were leading, that we were striving for every day, the expectations we were placing on ourselves and taking pride in, and therefore the expectations that we were going to expect of others. And so instead of this, what I think prior to not just myself, but myself and some others of the team getting there, which was kind of a ho-hum, almost a standing ritual of you're going to be oriented, you're going to spend one day in orientation. We really amped it up. And this was showtime, and we were damn proud of that organization, the work we were doing, and we weren't going to risk hiring people that didn't take that as seriously as us. And so we would say things like, if this isn't for you, that's okay, but you can't do it here because we're working too hard on taking our jobs seriously without taking ourselves too seriously, having some fun while we do it, holding ourselves to a high set of standards. And I think when we first started having those conversations, people looked at us like we had three heads, and then folks got into it, and it started to make a difference, and it becomes a self-fulfilling prophecy. It's oh my God, this is actually it is actually a more fun place to work. So I want to come. I actually want to come to work, and I want to solve problems because they're mine, because this is mine. So anyway, it kind of created a cool culture. And then some other things that we did that felt like really heavy lifting at the time were things as simple as let's start creating some standard work around how we answer the telephones at the switchboard. And what I was learning was those are the places that I could affect change because they reported. There's a little kind of draconian perhaps, but the head of the switchboard was on my team. So we could have a conversation about how can we make this happen? Let's talk about the benefits. And then some of the other things, when we started getting to some really big projects like building a new hospital wing, we went the really crazy route of actually asking the employees that were going to occupy this new space, what do you want in the space? We actually, what I now know is kind of user design. And experience-based design. We actually went to I remember going to the pathologists who were going to be in the new lab space and saying, what are your needs for space? And they're like, what? They wouldn't meet with me because I don't know whether they thought I was joking or something. I was like, no, what do you guys need? What do you want? I'm not going to say you're going to get it all, but let's at least have the conversation. So those are just some things we did.
So you were there for 8 years.
Yeah.
And you'd been with, prior to that, you'd been with Northeast for 3 years. So you now had 11 years of experience. Yeah, 11 years of experience in healthcare. And you make a jump out of healthcare all of a sudden, not for too long, but you joined a company called Curbside.
Yeah.
What drew you away from, you'd committed all this energy into healthcare, and then you jumped out for a little bit. What was the draw?
So there wasn't as much of a jump as perhaps it looks like. So Curbside provides valet parking services to hospitals. Well,
Okay.
it did at the time. I don't think it exists anymore. It got bought or sold. And the CEO of Curbside had, and I think I was actually a customer of theirs. They provided that service for us at Cooley Dickinson Hospital. And the CEO and I had gotten to know each other pretty well, and he wanted a chief operating officer. Timed at about the time when I had probably done all the growing I was going to do at Cooley Dickinson Hospital, and the next job would have probably been chief operating officer. And I think at the time Craig didn't have one because we weren't big enough. And I think Craig had gone away on a sabbatical, but we had an interim CEO, and I wasn't about to take over that person's role. So not that I couldn't have stayed, but the growing there was done, and I was looking for another opportunity. And I looked at an opportunity at a hospital in central Massachusetts, now part of the UMass system, and I looked at this opportunity, and this opportunity provided, I suppose, two big things. One was I thought it might be kind of fun to try something different, right? Like try being a vendor, try being on that commercial side where you've actually got to hone your sales skills, you got to hone your business development skills, you got to there's competition in the market that's pretty fierce. I just thought it'd be fun to learn something different, and operations for me are operations, so it wasn't that different. It was still going to be around people, and the other thing that it allowed us to do was it allowed us to move back to the coast here in Massachusetts. And while we loved, to your point in our conversation, everything about Amherst, we missed the ocean. And the Curbside job allowed us to move back to my wife's hometown here in Ipswich. So it was kind of twofold. It was try something new and move back to the coast and move closer to my wife's parents.
Those are good reasons. So you weren't with Curbside all that long because you moved on to, in 2009, you joined Massachusetts General Hospital, as the Senior Director of Service Excellence.
Yeah.
So kind of still staying in your wheelhouse of service orientation, it sounds like, but Mass Gen is a whole other animal, right? I mean, it's a different scale. It's a much larger organization than you'd been with in the past.
Yeah.
How'd that come about, and what was that like?
So I left Curbside because I got fired. And I remember the day I remember driving back from the office to my house, and I hadn't told my wife. I called one of my mentors, and I said I was beside myself. I said I got fired, and she said it's the best thing that's ever happened to you, because we all need one of these in our life. I was like, what are you talking about?
Okay.
And in retrospect, easy to say now, but in retrospect it was. And I don't mean to take that lightly, because I have friends and colleagues right now that are getting fired and laid off, and it ain't easy. And I think it's a little flippant to suggest in the face of a current reality but that's what happened. And so I had, there's a 5-month window in there where I had to look for another job. And I was just, again, blessed to be at the right place at the right time, where, similar to what Cooley Dickinson had been looking for 8-9 years earlier, Mass General was looking for someone with a service background, a hotel background, perhaps a non-traditional, non-healthcare background to lead their service excellence program. So I landed there. And it was interesting because to your point in your question mark about this being a kind of mammoth, big organization, as I made that, as I was making that transition, what was a couple of things that were telling at the time. One was, what was interesting was the people that wanted to send me to celebrate my new job at Mass General were my old Cooley Dickinson team. So if you imagine, I've been away there for a year, and they invite me to go back to Western Mass, back to the, as you coined earlier, the Happy Valley.
Yeah.
And take me out for dinner. And doctors and nurses. We just had this wonderful evening. And I remember one doctor pulling me to one side and saying, "Congratulations on the role at Mass General, but do you know what you're walking into? Because that's a real." I forget exactly how he described it. He said, "It's not the small loving family that we are out here at Cooley Dickinson. I remember thinking to myself, oh my God, what have I done? I'm walking into this kind of behemoth of a beast. Nothing could have been further from the truth. From
Is that
the
right?
day I arrived at Mass General, that was one of the most caring, loving, and that probably sounds antithetical to folks that know the size of the organization, but it came down to the people. The people that I got to work with were just some of the most superhuman beings doing some of their best work. Yeah, in a very different environment. You go from a 200 and however many bed hospital in Cooley Dickinson to a 1,000 bed hospital, on the banks of the Charles River there. Very, very different. But my goodness, what a special, special place of just some of the most, still to this day, some of my finest friends and favorite people.
So what was it like moving to that level of scale? I mean, so they were welcoming to you. They must have had a need, though, because, I mean, they're, again, bringing you in for that same kind of role. Were they struggling with the same kind of challenges, just at a different scale? What was the role really like?
So the role was less operationally focused than Cooley Dickinson was, right? So I had to get used to that. So it wasn't about having 8 direct reports that were very much running an operation. Right? So it wasn't one of your reports was going off and running food service, and one of your reports was. It was much more a team of consultants that was going to have to do more by influence and through collaboration than it was 300, 400 people reporting to you. So that was very different. The other thing is I'd had experience reporting directly to the CEO in my last, whatever that was, 2 roles. And now I walked into an environment where I had a dual report. So I actually reported to 2 people. One was on the physician organization side of the system. So if for those of you who know healthcare, that was the PO. So I reported to a doc and the PO, and then I reported to the chief nurse on the hospital side of things. So that took some getting used to as well, right? So dual report just requires some, you have to walk in eyes wide open, and it requires some clarity of conversation, clarity of expectations. It worked really well because of the 2 people I reported to. The primary job when we got there was how do we convert data that we had tons of into how do we turn that data into actionable different ways of working so that we get different outcomes. Because when we looked at the data, it was probably it wasn't as bad, but it was probably a similar situation as we were walking to at Cooley Dickinson. And for an organization that prides itself on excellence and on being recognized as one of the best in the field, the data we were looking at was antithetical to that. And so that was the ask pretty early on, was how do we improve our patients' perceptions and experiences of the care they're receiving. And it ran a gamut of different projects, but a lot of the early days of that was me just immersing myself and my team in the work of our caregivers. What does it mean to be a thoracic surgeon on your feet for 12 hours a day? Well, the only way you know that is to go and ask if you can shadow a thoracic surgeon for 12 hours. Go spend 24 hours in a wheelchair and navigate the campus. Go walk in the shoes of the nurses on the floors and the techs in the OR and the food service workers in the cafeteria. And so a lot of it early days was probably maybe not full-time, right? But, a good 3 to 6 months of just immersing myself in what is their work like, and do I understand it, and can I speak their language? And that was eye-opening, lessons I'll never forget. And it drove a lot of the work we ended up doing, because you get to work in these people's shoes and you go, my God, it's just bloody difficult to do your work. And you don't know when your patients are being admitted to the ED. And you don't know how long it's going to take to turn around an OR. And you don't know who's on who's your scrub nurse. And you don't know this, And then your anesthesiologist is late, and then your patient's not prepped, and then you don't have your equipment, and then at the end of, and then someone, flippantly tells you that so and so is on the phone, and you just scrubbed in, And then on top of all that, someone comes along and tells you, oh, by the way, Dr. Mark, your patients were asked about their experience of care, and they thought you were a bit curt with your answers or a bit impatient. And you just look around and you go, well, no wonder. We've just made it bloody difficult to be our best selves. And so we learned that from the inside in, and that drove some programs that we then put together and had a lot of fun with.
What can you give an example of the kind of thing you put together? Say, I don't know, from your physician perspective, what was it that you? What can you give an example of a program maybe you put in place after you did all this?
We had a fun platform as well, and don't get me wrong, we were provided an environment that was just made doing this fun, and so the PO had a performance improvement incentive for their physicians. It was a glorified way of saying they would withhold a small amount of the physician's annual compensation, and then release it if that physician attended a certain number of hours of education. And so we just realized that platform existed, and we kind of went to that with, well, let's make this year's, or I think a part of this year's, how might we improve patient clinician communication? So the organization said, great idea. Then the question was, well, how to do that on a careful kind of budget conscious, in a budget conscious way. Well, when you're at Mass General, much like at many organizations, you've got some experts within your own halls. And so we kind of we asked around and we said, okay, anybody crafting a particular piece of research or expertise or coursework that you want to share with your colleagues around improving communication? And people just start coming out of the woodwork. And they were already faculty. And so,
yeah.
Right. And so we got Helen Reese, who founded the firm Empathetics and has done this, just some of the most remarkable research on how do you teach empathy. Helen said, well, I can teach people how to be more empathetic. We thought, oh, that's one course. We just did that. Then we had a whole crew that would think with Greg Meyer had just come back from learning about how do you create a just culture so that it's safe to speak up and safe to share when you might perceive that a colleague is quote unquote acting out or being less than appropriate, professional, or otherwise. So we had that, and then I forget we had another one. I'm forgetting. Oh, we had an incredible individual whose name is escaping me. It doesn't matter, but she'd done this amazing piece of work about kind of using actors to help people have very difficult end of life conversations. So, and then we found, okay, well, maybe we'll create, and we just wrote a curriculum. I think a colleague and I wrote a pretty basic curriculum on teaching communication basics. And so between these 4 buckets, we had built a curriculum that we could then, through the summer, take the 2,000 attendings at Mass General through. And the reason they came to class was because they were going to get some of their income back. So it was pretty basic, I suppose. And the course we put together was just pretty straightforward. And I think I was struck by the expectations we sometimes have of people without empathetically understanding the resources they have not been given. So we would take them the data. We would take clinicians the data and say, well, your patients say that you don't explain things in a way that's easy to understand. Well, of course I do. Well, why don't you show me how you explain something? And so playing the tape back, giving people the data, and then showing people some research that suggests, and this isn't new to folks, but showing people research that suggests that a patient overestimates the amount of time you spend with them if you sit. They overestimate the amount of time you spend with them if you look them in the eye when you're communicating with them. And so these really little just tips and a safe environment to talk about it and a safe environment to practice. So we kind of rolled that out. And again, it's not rocket science, but it's the empathy to appreciate that folks might not have had it, and then the time, the grace, and the space to go do it. So when we were afforded all of that.
Neat.
Yeah.
Well, you were at Mass Gen for a couple of years, and then you joined a firm called, I think this is an acronym, CRICO, CRICO?
Control Risk Insurance Company.
So is this was looking at this is something affiliated with MassGen and partners?
Yeah, so Crico is the largest, oldest captive insurance company in the country for medical malpractice insurance. And
Okay.
it's best way to describe it is almost think about it like a mutual. So it provides medical malpractice insurance for anyone or anything. That's a little crude, but forgive me. Affiliated with the Harvard Medical School. So if you are a practicing clinician within a Harvard medical institution, you are insured by Crico. So Crico is bottom line is Crico is an insurance company that also then uses its data from medical malpractice claims to improve patient safety, mitigate risk, and reduce loss, which of course makes sense to the owners and the shareholders, because if you can bend those curves, you are costing yourself less from an insurance standpoint. So that's what Crico is.
Okay. So you are not an insurance guy.
No.
So I assume you went. So what was the capacity you went over to them for?
So Crico has a small division called Crico Strategies. And so Crico cannot and does not sell its medical malpractice insurance on the commercial market. What it can do is that latter part of what I was just describing is it can sell membership in and access to what is ostensibly an enormous database of medical malpractice claims. And so Crico Strategies is a little, when I got there, it was kind of 10 people strong, a department of Crico that provides external consulting services to hospitals that want to learn from their medical malpractice data how to mitigate risk and improve outcomes. I'm going to guess that there may be a question about how do you go from patient experience to medical malpractice patient safety?
Yeah. I mean, you were doing some safety stuff, I assume, right?
Yeah.
So in your capacity, but I mean, it's a pretty big jump.
Well, partly I'd learned about Crico at Mass General, and because Crico incredibly insightfully supports programs at its member hospitals, of course, which Mass General was one, that better educate and train clinicians so that they're less likely to be unsafe. I mean, kind of go further down the river, if you like, less likely to get sued. It's in Crico's best interest to make sure that those programs are funded properly. So I had seen a couple of programs be funded at Mass General by this organization called Crico, so I'd gotten to know it a little. The headline that really opened me up to their work more broadly was reading an article, I think it was in the Wall Street Journal, the New York Times, I forget, but it was authored by this guy called Bob Hanscom about the crosswalk between patient complaints and medical malpractice cases. And it just resonated with me because, in fact, it had been a lot of our conversations with the docs at Mass General is improving your skills of communication and showing a patient that you care about them as a person is not just good for the patient-doctor, patient-clinician relationship, and there's plenty of studies to show that. It's also when something does go wrong, because it might, they're less likely to sue you. A clinician getting sued is one of the most painful things to watch someone you care about go through in their career. It's just heartbreaking. I think any of us getting sued as a person is a heartbreaking. And so this very quickly, even when I was at Mass General, became just this. It was like these are two peas in a pod. This wasn't just about let's get good patient satisfaction scores. No, this was let's give you the tools to get terrific outcomes and actually kind of mitigate the some of the reasons why people might sue. And so then reading this article by Bob, where there was a deep dive into this crosswalk of patient complaints and then why it is that people sue. The funny thing for me at the time is we had engaged a consultant at Mass General who had the same last name, was Hanscom. So I went to Diane and I said, I read this really cool article by this guy called Bob, who works for this company called Craco. And she just started laughing. She goes, "It's my husband." And she goes, "You guys should talk. You guys should have lunch." And so we went out for lunch, and they were looking for someone to partner with one of the other executives at Craco to consult business development in this space of improving patient safety through better understanding why it is that people sue. And that just, I suppose, again, now that you've got me thinking about it, Mark, I thought, why not try something new?
Yeah. But that's definitely, I can see a line there that, like, you're talking about as being, and a lot of what you just talked about was just like satisfaction, like, making people believe that you cared, not just looking at the technical health care delivery portion of the safety, but I mean, that seems like that's been something you've been doing.
Yeah. I mean, when you, and I learned this at Craco, I mean, when we would ask, and they did some really robust research, and they do some phenomenal research and deep dives into the data. But when you ask patients, why did they sue? Why did you, turn to the nuclear option? It's not because I was injured. Sometimes it is, right? Sometimes I want monetary relief for a lifelong of, for what's now going to be a life of medical bills. I get it. But sometimes, Mark, it was as straightforward as they didn't listen to me. They didn't get back to me. They didn't treat me with respect. I don't want anyone else treated like this. And then what was really heartbreaking, and I saw this at Mass General, was when you would then turn around to the doctor, the named clinician that was getting sued, and you share all this and say, how does this make you feel? And it gets really emotional. And they say, I didn't know what to say. I didn't know how to say it. I didn't know that it was okay to say, I'm sorry. And you just go, oh my God, we've created this we've designed we have, by lack of design, created a broken system. We haven't given the clinicians the resources to even have these conversations. It was just heartbreaking. I mean, I remember hearing a story at Mass General about a pediatrician who, they knew from the day this little kid was born that he was going to have a short life. He had too many comorbidities to not. And this doctor had been a part of his care team from the age of birth through, I think, what was maybe 11. And when you heard the mom's side of the story of how the doc communicated that these were his final days, and then you heard the doc's side of the story, both just brought you to tears, because the mom's saying the doctor all of a sudden felt aloof, disengaged, didn't care about us, just wanted Joe, for the purpose of today, to die. And then you hear the doctor saying, I poured 10 years of my life into this kid's life, and I couldn't save him, and I didn't know what to do. And so you start to see both sides of this heartbreaking reality and go, well, we got to do better, people. We got to lean in and find a better way.
Yeah. What was it like moving to the consulting side? Because you had always had internal clients, right? Yeah. If you will, you were an inside asset. Now you're outwardly focused. You're providing services to a variety of clients, right? So this is really your first consulting role, correct?
Yeah, very much so. We've done a little bit at Mass General. One of the beautiful parts of working at Mass General is because of the brand recognition, and not just the brand, just because of the organization that you're fortunate enough to be partnered with and a part of. Folks turn to Mass General and say, "Hey, you guys do this at Mass General. You must know the answer." Right. We were very fortunate to be afforded some of that grace. So we've begun to do a little bit of it there. But yeah, really getting to Craco was a wild opportunity. And what I had realized that I was drawn to this space of polite, kind, when I work hard to be polite and kind, truth-telling, and not from a place of I want to tell you the truth because I want to use it as a weapon, but I want to tell you the truth because together, if we know the truth, we can, and if it's not a truth that we want to keep perpetuating, we can do something about it. And that was the was the reality of what you learn when you're looking at an organization's kind of malpractice or loss history. You get to sit with the CEO and say, "Hey, we've just looked at your anesthesia rates, severity, and what it's costing you, and you're an outlier when you look at other hospitals your size. And if you do that, if you have that conversation in the right place, at the right time, in the right way, with the right data, people open up and people get real, and people go, I don't want that to be the case." And it just, that for me is a very, what's the right word? It's just a very, it's a very authentic. It's almost, there's almost a, I don't want to get, there's almost a spiritual nature to it, right? It's when you sit across one-on-one with another human being who's got a big job, right? And you're able to connect with them as a person and go, it's okay. We can work this out. And I just, that's a very humbling, special place to be, and I love it because I don't know why I love it. I just love it. It's very special to. So what I didn't realize it at the time, but that's what I was drawn to, and Trico allowed me to do more and more of that.
So, what was different about being a consultant as opposed to being primarily focused on, the internal organization?
The upside and the shadow side of not seeing something through to its full kind of life cycle, right? So if I go back to Cooley Dickinson or even Mass General, we could go from birth to full maturity of a project, and I mean that quite literally, right? We could sit in a room with nothing and just our ideas and go, wouldn't it be cool if we created a pediatric hospitalist program? And everyone looked at us and said, "You're going to do what?" I said, "Well, wouldn't it be great if we had a 24?" And so you go from nothing to building a business plan, to recruiting, to bringing people on board, to establishing a program, to then, 3-4 years down the road, looking back over your shoulder and not being able to imagine a situation where you didn't have that. And the same with buildings. I mean, you build a building, you go from it's a parking lot where people park cars to, 2 years later, there's people getting surgery in a state-of-the-art building that you can proudly go to bed at night and go, I had a hand in that. And to consulting, where more often than not, you don't get to see something through its full life cycle. So that was very different. And what I found difficult at the time was I didn't like the word consultant, because I'd had a bad experience through my career with it, which is typically the consultant was going to be the person who was going to show up at some great expense, was going to tell me what I wasn't doing right, was going to carry on like they knew my job better than I did. And a lot of the time, probably 40-50% of the time, consultants had actually been folks that were going to show up, that were going to cut expenses out of my budget, so they were going to actually impact people's lives. So that felt antithetical to helping people. So I had a real hard time for a while, even calling myself a consultant. It felt a little, I don't know. It wasn't something I was comfortable with. I had my own hang-ups about it. And it was kind of, my doing, not, it was just silly.
Well, you were with Crico for almost 5 years, and then joined a company called Wellesley Partners, which is a general management consulting company.
Yeah.
So how did you make that jump? So Wellesley isn't healthcare per se, right? It's they've got a broader. Do they have? Are they? I didn't pick up that they were specifically a healthcare.
They are.
They are. Okay.
Very small. And I had known Wellesley Partners since first ever getting to Cooley Dickinson, and they were actually the antithesis of what I just described as consultants. So and they were the bright spot that would kind of look at, and Tim Sullivan, who's the founder and principal of Wellesley Partners, I would look at him and go, wow, Tim's the kind of consultant that if I was ever going to be one day, that's what I want to do, because that's authentic and that's real and that's polite and kind and yet also pragmatic and kind of cuts through the BS. So what happened was we were wrapping up a piece of work it got really complicated. We were wrapping up a piece of work at Crico at UMass.
Oh, okay.
And the other interesting thing at the time was Wellesley Partners was providing consulting services to Crico. I was sitting with the CEO at UMass, who, this was not the first time in my career, he was trying to recruit me. And the conversation went something like this. He said, my patient experience scores are deplorable. I know you weren't here doing a patient experience assessment. You were here doing a safety risk assessment. But you also picked up on, and there was some really kind of bad practices that they were engaged in. Again, not through intent, I think just through default. And I said, okay, what are you going to do about it? He said, I'm going to hire you to be my chief experience officer. And I said, it's not the right answer. I said, what do you mean? He said, this is the second time in your career I've made you an offer and you don't want to come work with me. Is it me? I said, no, I think you're asking the wrong question. I said, I don't think you know enough about the problem. That simply hiring into a role that's got the right words in it is the way to improve the culture, to improve your patient experience. And so it's kind of all my hotel operations experience is kind of coming back to the forefront. And the other thing I shared with him, I said, how do you think it will play out to the rest of your senior team if something as basic as the experience of care that our patients are reporting is somehow going to be solved by me making another, I forget it doesn't matter what the number was, but these are significantly expensive payroll positions. I said, what I will do for you is I'll consider consulting for you, and together we'll work out what the problem is, and then we'll design a plan to get us out of the hole. And I'll act, if you want, as your interim chief experience officer, but I'll do it as a consultant. He said, you're hired. And of course, then I had to sit there and think, well, technically I'm still an employee of Crico. How do I do this? And so the way I did it, Mark, was by joining Wellesley Partners. I left Crico, joined Wellesley Partners, because that gave me the platform upon which to then consult. And so it actually came about really rather naturally. And then the wonderful thing was I didn't get to consult as a brand new, single shingle hanging individual. I got to have, some resources in Tim and some of the other partners behind me that we could actually consult on other aspects of his business strategy and other things. So it was just, again, right place, right time. And, throwing something out there, saying yes, or just saying, sure, I'll do it. And he said, okay, let's do it. So that's how that happened.
Okay. So you were there for about 3 years with Wellesley?
Yep.
And how was that experience different from the work you were doing with Crico? I mean, you were doing consulting with Crico. How is that different?
Very small company, Wellesley Partners. So when you are, I think we were small. I mean, I think the polite way of saying it is boutique. And so you are, when you are on an interim gig, like then I was for 14 months, I wasn't out doing business development. I wasn't out doing, creating collateral. I wasn't out building relationships. I wasn't out doing, because you couldn't be, an N of one, and we were a very small firm. So that was very different. And while we were in healthcare, it was a more general consulting to healthcare. So it was less specific around patient safety, risk mitigation. It was more general around organizational development, organizational behavior, culture change, service improvement. So it was a broader waterfront in some respects, and a very small team.
You left Wellesley Partners to come to TiER1, which is where you are today, TiER1 Performance Solutions.
Yeah.
TiER1 is also a management consulting firm. You have on your LinkedIn profile, I am on a mission with Tier 1 Healthcare to improve the performance of organizations through the performance of its people to build a better world. That's a that's a significant mission. I like that.
That's it.
So what does that mean?
What does that mean? It's, I mean, I suppose you could look at it and consider it a little Pollyanna. And I've been called Pollyanna in my career, and I don't really care anymore. I think organizations are people. I mean, bottom line. I mean, the buildings we walk into, the policies, the procedures. This is not what brings an organization's work to life. I mean, you know it, Mark. You know, in your role. I mean, it's the relationships we're in. It's how we show up. It's how engaged we are, and I truly believe that the organizations that I see soar and make a difference are due to the people that make them up. And I think if we can unleash that and get out of the way of it, and build it up and give people the tools and the resources to be their best selves, I think we can change the world. What do I mean? Further to that, I mean, you don't have to go too far to research the fact of how many people are truly disengaged in their work, truly miserable. I mean, and I know that we're in a time right now where there's a lot of folks that are out of work. So being sensitive to that, but there's a lot of folks I know that don't enjoy what they do. And I think it's kind of heartbreaking that that's also the message that we're telling our children. I mean, at the end of the day, unless our children, and I'm not, but unless you're independently wealthy and don't have to work, you kind of got to do something to pay the bills, right? And I'm just struck by the gift we either do or do not give the next generation when work's anything other than something we love doing and are in it with people that we trust and respect and have our backs, and we believe every day that we can make a difference. So I'm rambling a bit, but that's probably some kind of themes to why I believe that to be the case.
So Tier 1 Healthcare, is that that's a subdivision of Tier 1? So they do, we had a little conversation about the organization. So they do more than just healthcare.
Oh yeah.
So I take it it's a much larger organization than Wellesley was.
Yeah. It's about 250 people now, regionally located from Ohio up to DC to Boston, out to Denver, Pittsburgh, Atlanta.
And so how do you fit into the healthcare division? How does the healthcare division work? If it's a big organization it doesn't have the same kind of geographic footprint that Wellesley, a much bigger footprint than like Wellesley would have, I assume.
Yeah, much bigger. So yeah, you nailed it. I mean, healthcare is really, we think about healthcare at Tier 1 as almost, it sounds weird, but we think about it as a geography. I mean, it's a market that is unique enough from what folks buy that we have carved out healthcare, and we've also carved out government as particularly kind of specialized verticals that we sell to, because it requires a slightly different knowledge set, language, expertise, skill, and there's a different ask of us as well. So specifically in healthcare, right now we do a lot of accreditation, regulatory preparation, and management of those types of programs for hospitals and hospital systems. We also do, so put another way, we prevent people from getting into regulatory distress, and if they are in there, we help get them out. And it's through we have a very expert level of consultants that know that world better than anybody. So when an organization is in a bind from a regulatory standpoint, they call us, and we go help. And then we do a lot of other we provide a lot of other services and offerings in the space that I would describe as human performance challenges. So we help hospitals identify their problems and solve them. And typically, if they've got human beings associated with them, then we can help.
Most hospitals have some human beings in them.
Most hospitals
I've
have some
heard.
human beings, Mark. Yes, they do. And most of the time, those human beings, need a little support or need support in how it is that we might help improve performance.
I've never done consulting work. So, I think some people kind of have this, similar to what your experience was, they see it from the outside, or this people show up. How does it all work? How do you, how does a job come about? How do you come to be on that team? How does that all work?
Great question. One of those things doesn't look like the other. None of them look like the same. They never repeat. If you think you've figured it out, that they all, I think it would be fair to say, come through relationships. So someone somewhere has got to either they know someone at TiER1, they know of our work, they've heard of our work through someone. So a really deep, rich connection of relationships. We get passed around, right? So it's the best way to get referred is to get passed around by someone who loves what you do. And I'm not kidding you, man. It gets emotional. We had a client last week who said, "I love you guys. I can't imagine us being where we are today without you. The way you guys showed up and you listened and you." So let me start there. So the how we get the work is through our reputation, through our relationships. And then in really large organizations, when you do work that a department loves, and they're all standing around, because not so much now, but the proverbial water cooler, and someone says, "Well, how did you get out of that bind?" You go, "Oh, well, we used TiER1." "Oh, you did? Can you connect me with them?" So we get passed around internally as well. And don't get me wrong, then there's some prospecting elements to our business development where we are going out, and we just had a call this morning. I go, okay, in this geography, who do we think it would be fun, interesting, of value to work with, and how might we go and tell our story to them, and do it in a way that's just the word that keeps coming to mind, Mark, is just do it in a way that's empathetic. So do it in a way that doesn't come from a place of, we're TiER1 and we've got all these things that we're going to sell you, but does it from a place of, we'd love to know what are you grappling with? What are you working on? What's getting in the way? So identify the problem, understand the need to want to solve that problem. If we can then show someone how it is that we have either done that in the past or might do that in the future. So then it gets into, we will walk into situations where we don't necessarily have an answer, or what did our CEO Greg said something wonderful the other day. We don't necessarily have to always be right, but we will get it right. So we don't take ourselves that seriously. We've always got to be right up front, or we've always got to have all the answers. We'll get it right, because if we listen long enough to the right people, and then we solution it properly with enough creative, compassionate, talented individuals, which is essentially what TiER1's full of, we'll get it right. So relationships, some hunting, some fishing was your answer to how we get the work. Projects kind of emerge when we listen and then we understand what the work is. How we end up on projects is either we internally will look around and go, I need a really good instructional designer, or I need a really good creative resource, or and we'll go handpick them, or we have a pretty robust process internally to say, hey, I'm working on this project with this healthcare organization. I need 4 of these. Who wants in? And people go, oh, I'll get in. So
do you only work with healthcare? Do you personally? I know TiER1 not, but okay. So you now go outside of the healthcare industry.
Yeah, in fact, my first consulting gig at TiER1 was actually with Virgin Voyages. So Richard Branson's launched a cruise line, which of course is on pause right now. But my first consulting gig with TiER1 was actually to go and be a subject matter expert with my hotel background to some of their hiring challenges for a cruise line. So yeah.
Okay. What do you like most about the consulting role? What keeps you fired up about it? You've been doing it for a few years now.
Um, no 2 days are the same. No two clients are the same. I love being challenged, and I love helping people. And if we can find a really meaty, juicy problem that folks are having a challenge with, and if we can help folks solve for that from a place of authenticity and kindness and compassion, that's pretty sweet. And working with people that push me to be better. And I turned 50 years old last year, and I'm still learning every single day. And that's a pretty special place to be in.
And that's because you're in an organization that forces you to learn all the time? Is that...
I wouldn't say forces. I mean, it's an expectation that we have of each other. It's we walk into everything with a learning or a beginner's mindset, kind of, and that's not a world I was used to in healthcare, right? Everybody walks into the room professing to be the expert, and that always used to rub me the wrong way, and I didn't know why till I kind of now know, which is it's okay to have expertise, but I'd rather walk in from a place of humility and just listen, and so yeah, it's part of who we are.
What makes a good consultant? What kind of skills, knowledge, or attitude? What is it that makes someone effective in the field?
My mother used to say, you've got 2 eyes, 2 ears, 1 mouth. Use them proportionately. That's probably a lot of it, right? It's kind of patience with self as much as with client. I get very excited if I think I see a solution, and I want to kind of, I can almost get giddy. I want to tell you what the answer is. And so it's patience to say, okay, Richard, just stop. Don't rush to solve. So it's patience. Persistence. I mean, I jokingly said to one of our younger business development folks this morning, you've got to kiss a lot of frogs. It's just persistence. Don't take it too personally. Humility. Just and being okay with kind of live experimentation, kind of being okay saying, I don't know what the answer is, but I know together we can figure it out. So it's probably those traits, and probably a little bit of hustle. We're a professional services firm. I mean, if we're not utilized, something's not working on the business side of things. So there's always this kind of tension of all this creative, interesting, fun work, but then how do we stay utilized? How do we make sure that we've got the right people working on the right projects, and then not to this is going to sound really a bit antithetical, not to celebrate a win too long. And I've had to learn that the hard way. Say, okay, you want a client, great, get that project rolling. Now get onto the and if that's and that might not work for folks, but it seems to work for me. It's like, okay, a win was won on Friday. Now we need to get back. It's Monday, and we need to get back onto what's next. So, cool.
Wow, that's a treadmill. I don't know. That sounds intimidating in some ways, right? Like there's no time to sit back.
Well, there is. I mean, there's a ton of time to celebrate. Yeah. I think we do it.
Sure.
I don't mean to imply that it's a treadmill. It's again, if it appeals to you, it appeals to you. And it's and again, doing it with people that I have a friend, Steve Farber's my mentor, and he talks often about do what you love in the service of people who love what you do, and we get to do that every day. So it doesn't really feel like consulting. It doesn't feel like sales, but it is. I mean, we're a consulting firm. We know what we are, but it stops feeling like that.
Well, let me toss you a couple of quick leadership questions, and then I'll let you go. So, one of the things I like to ask senior leaders is, what's your leadership philosophy?
I lead with love. I lead with optimism, and I lead with a growth, what we think of as an infinite mindset. I lead from a place of trust and transparency, and not trust that you have to earn, but trust that I will give you. And It's not something you have to earn. It just I trust people, and now prove me wrong, fine. But and I lead from I lead with laughter as well, I suppose, laughter and love, and take my job seriously without taking myself too seriously.
Who did you learn that from?
Probably a bunch of people. Robin Brown at the Four Seasons, John Lowe, my professor at Simmons, Linda Galindo, Steve Faber. I'm learning it today from everybody on my TiER1 team, from Greg Harmeyer, Jerry Hamburg, Brian Lapthorne, Katie Fry, Anna Wolf, just and Dustin Shell. I mean, just incredible people that get to show up to work with every day that embody that, and then also provide harsh feedback when necessary and appropriate. And I think that that'd be another thing I reflect on. I think feedback, when delivered in a timely way, is one of the most loving things we can do for other people.
What do you look for when you're hiring leaders, or maybe if you were hiring a consultant, maybe, and I don't know if those would be the same thing?
Probably some of what I just articulated, right? I mean, do you take your work seriously without taking yourself too seriously? I suppose if I go through an interview and someone hasn't laughed and we haven't kind of joked about something, I'd be a little weary or leery about hiring. I think having that beginners and or learners mindset. I think every time we walk into a scenario with a prospect or a client or even an existing relationship, being an engaged learner and beginner, even if we have a wealth of expertise and experience that we bring to the table, is an important trait to bring to bear. And then I suppose a desire to want to share with others. So both, again, when we think about expertise, it's not that I am an expert, therefore I'm going to tell you something, but I have expertise that if the time is right and the place is right and the opportunity is right, I'm going to share it. I have insights I want to share, or I have relationships that I want to share. I mean, I've been blessed now, however many years into a career, to have a ton of really good relationships. They're not selfishly mine, other than I'm blessed to have really good relationships with people. I want to share those. I want to give them away, and not in any kind of insincere way, but in a way that we should be connecting good people with good people. And so if I get, it's relatively easy, I think, to get that sense from, is this person across from you or with you thinking along the same mindset, I suppose.
I like what you just said about, giving away relationships. So that makes me, so I want to ask you about mentors. You sounds like you've had some good experience with mentors and mentorship. What does that mean to you? What does a good mentor do?
Yeah, just probably what we were just talking about, Mark, shares unconditionally. I mean, I think and acknowledges that the mentor, sometimes I grapple with mentor-mentee seems to be this kind of almost like a hierarchical relationship, where for me, the best opportunities to mentor, I've been mentored as much as the mentee, if that makes any sense. There's always something to learn. And you get to learn from someone perhaps at a different stage of their career, or perhaps in a different space, or perhaps in a different part of their world. So I think that's always kind of rolling around in my head. I think the other thing would be most folks that are either where I'm at or further beyond in their career have had an experience where they've either needed to connect with someone, needed to network, needed to ask for help, needed to, have been in a junior space or place. And I think we just have to remember that. And so sometimes I see kind of more junior people, what we typically label as mentees, having a really hard time finding a mentor, or having a really hard time networking. And I just think for those of us that are, further into our career, we were there once, and we owe it to folks to unconditionally share and unconditionally network and unconditionally connect and just do people the solid.
So, last question. I teach primarily in an undergraduate program. So, for young people entering the field, going into health administration, why should they think about a career in consulting? Or maybe they shouldn't. Maybe they should wait.
It's a really good question, Mark, and I hear it a lot, which is, I want to be a consultant, and it's a really broad bucket, and we could probably spend another hour and a half on that. But so I would say think less about wanting to be a consultant, more about figuring out what success looks like for you for whatever this next chapter is. And as you can see, I've probably rewritten some of those chapters every 5 or so years. And it should be rewritten. It changes. I don't know about you, but, my definitions of success when Robin and I were first, when I was shifting from the hotel business into healthcare, we had one child, were very different than they are now when that tap at the door back there was, my 17-year-old going off to work saying, can I take the car? I mean, you've got different things in your life. So figure out what you want what success looks like and get really kind of very kind of tangible, very practical about that. It looks like I'm doing this. Find folks that do that work and resonate with you, so that and if there's an opportunity to then kind of come alongside and learn with them and from them, that's awesome. That might be in consulting. I think the challenge for a lot of young folks coming out of college thinking about consulting is you can go and join a consulting firm. You can go and call yourself a consultant if that title is something that's important to you. What you'll likely do coming off a undergraduate or graduate degree is you'll end up joining a large firm as probably an intern, and then just kind of start climbing the ladder, and you'll be a junior consultant on a lot of big projects, and you'll do a lot of number crunching, data work. You may get to put some PowerPoint presentations, but it's going to be the senior consultants, the principals, the partners. They're going to do the real, what we've been talking about. So I think the question is really broader. What is it? Why do you think you want to be a consultant? What is it about it? And some people will say, well, the travel looks really glamorous. Well, that's honest, but it ain't glamorous. But if you don't want to travel, consulting is probably not your gig. But so I guess it's less about consulting and more about kind of what it is you want to do and who do you want to be doing it with. Let's answer for that. Because the other thing, my natural response to folks that are younger in their career is, what are you going to consult about? I mean, and more often than not, someone's going to give me an operational challenge to ponder that I'm going to go, I've seen something that looks a little bit like this. Or if I haven't, I'm going to pick up the phone and call Mark, because he might have. And if he hasn't, he's going to pick up the phone and call so-and-so. So we've got a network, we've got some experience, we've got some expertise. We're not going to be too easily put off. We're not going to be too easily offended. And I just, so can all of that be in the heart, mind, hand, soul of a new college grad? For sure. I'm not implying that. But I think the bigger question is, what do I really want to do? And I've probably by accident become a consultant. I don't think I ever said, I want to be a consultant one day, but maybe I did. I can't remember. I don't know if that answers your question, Mark.
That's pretty good. Well, Richard, thank you so much for your time today and your generous sharing of your story.
Thank you, my friend. I really enjoyed it, and it's a pleasure chatting with you. I really appreciate it.
You've been listening to the Health Leader Forge, a joint production of the College of Health and Human Services at the University of New Hampshire and the Northern New England Association of Healthcare Executives. Please go to our website, healthleaderforge.org, for more information or to leave comments about today's podcast. Look for Health Leader Forge podcasts on iTunes, Stitcher, SoundCloud, and other podcast distribution sites. Thanks for being a part of the Health Leader Forge community, and we'll talk with you again soon.